According to research published in 2025 by McKinsey, 72% of healthcare executives say AI is reshaping their competitive advantage right now. But here's what matters. Only 23% of them can actually articulate how it will impact their revenue, operations, or risk profile in the next 18 months. That gap between adoption and understanding is where most leaders get blindsided. You've probably heard that AI is transforming healthcare. Your board has asked about it. Your competitors are announcing pilot programs, but the reality is messier than the headlines suggest right now. Healthcare systems are investing billions in AI infrastructure they don't fully understand. Radiologists worry about job displacement. Compliance teams lose sleep over regulatory uncertainty. CFOs can't justify ROI when vendors keep shifting the goalpost, and patients? They're still wondering if an algorithm should be part of their treatment decisions at all. The stakes aren't abstract anymore. They're in your P&L, your litigation risk, and your talent pipeline. What we're unpacking in the next 8 minutes isn't hype. It's a practical 3-part framework that separates the AI applications actually working in healthcare from the ones that won't. We'll show you where the real clinical and financial impact is already happening, how to evaluate AI vendors and claims honestly, and what organizational capabilities you need to build right now before the competitive window narrows. This isn't about becoming an AI expert. It's about making decisions that don't expose you later. Point 1. Diagnostic AI has already crossed the clinical credibility threshold. The evidence is no longer theoretical. A 2025 study from The Lancet showed that AI-assisted image analysis in radiology increased diagnostic accuracy by 14 to 18% when paired with human radiologists. This wasn't in a lab. This was in 3 major US health systems running production workflows. And the time savings were real. 34% reduction in interpretation time per image. Mayo Clinic integrated AI into their oncology screening pathways last year and reported a 23% improvement in early-stage detection rates within 8 months. The application is straightforward. If your organization reads medical images, radiology, pathology, dermatology, you have an obligation to evaluate what's commercially available now. This isn't a 3-year roadmap decision. This is a 2026 decision. You're not choosing whether to use AI here. You're choosing whether to use it or fall behind on quality metrics your accreditors are already watching. Point 2. Operational AI is where most executives get the ROI story wrong. Healthcare leaders see ChatGPT and assume AI will handle clinical work. That's backwards. The immediate, measurable ROI is in operational workflows that have nothing to do with direct patient care. Administrative claim processing, scheduling optimization, staff resource forecasting. These are where AI is actually generating returns in 2025. Cleveland Clinic deployed machine learning models for surgical scheduling last year. Result: 19% fewer same-day cancellations and 21% better OR utilization. That's not incremental. That's the difference between running a 78% capacity facility and running it at 95%. The financial impact compounds monthly. But here's what most executives miss. These applications require clean data infrastructure first. You cannot apply AI to a broken process and get good outcomes. The organizations winning here invested in data governance before they invested in algorithms. Your application strategy should be ruthless. Start with processes that are already measurable, already painful, and already have good data. Claims processing gets fixed before you touch clinical workflows. Scheduling optimization before you touch diagnostic support. The sequencing matters more than the tool selection. Point 3. Regulatory and liability architecture is the filter that separates real implementations from expensive pilots. Here's what's changing in 2025 and 2026. The FDA's guidance on AI as a medical device moved from abstract principles to specific requirements. Any AI system making a clinical decision, even a recommended decision, now falls under device classification. That means validation, post-market surveillance, and documented evidence of safety and efficacy. This is not optional. It's not something your vendor handles. Your organization is liable for the claim. Gen AI adds another layer. If your system uses large language models to draft clinical summaries or treatment recommendations, you need documented workflows proving human verification happens before deployment. The Veterans Health Administration released implementation standards in early 2025 that set a bar for healthcare AI governance. If you're not aligned with that framework, you're exposed. The application here is governance first, not technology first before you contract with an AI vendor. Your legal, compliance, and clinical leadership teams need to align on your risk tolerance. What decisions can AI inform? What decisions require human override? What audit trail do you need? Build that policy framework before the tools arrive. Then select vendors who fit the framework instead of rebuilding your governance around whatever platform wins the vendor beauty contest when you've embedded these 3 elements. Clinically credible diagnostic AI, optimized operational workflows, and governance architecture. Something shifts. Your organization stops running separate speed and safety tracks and starts fusing them. You're improving diagnostic accuracy while reducing clinical variation. You're reducing administrative waste while freeing clinicians to spend time on what they're actually trained for. Your boards aren't fielding anxious questions about whether your organization is falling behind on AI. They're reviewing concrete results, improved quality metrics, reduced claim denials, faster throughput, lower burnout among your clinical staff because they're not drowning in administrative overhead. Your competitors aren't just adopting AI faster than you. They're integrating it into the way they actually work. And somewhere between month 9 and month 18 of that integration, you realize AI wasn't the transformation. Clarifying how you actually work was. The AI was just the tool that made it visible and scalable. Here's what you do now. First, subscribe to Apex Minds and hit the notification bell so you don't miss the frameworks your peers are already running with. Second, share this video with your chief medical officer, your chief operations officer, or whoever owns AI strategy in your system. This conversation is happening in your organization right now. Make sure it's happening with clarity and alignment. In next week's video, we're drilling into the one AI application that's generating the highest ROI in enterprise healthcare right now and why most executives still don't understand how to measure it. You don't want to miss that. Let's go. Thank you so much for watching this video. If these insights resonated with you, please subscribe to Apex Minds D4J and hit the notification bell so you never miss our weekly content. Share this video with a colleague who needs to hear it. We will see you in the next one. Keep pushing forward. Thanks for listening. If you found this valuable, please subscribe to Apex Minds D4J for more powerful insights. See you in the next one.